everybody, I'm going to teach you some important rolling techniques for certain muscle groups and also how to warm up before you run. Sitting in class all day can cause us to lean a different way or to favor one side by crossing legs and kind of throws our body off. So before you run, you want to make sure you realign your body so you don't injure yourself. You want to keep yourself as flexible and aligned as possible so you can reduce injury rate and practice harder and harder. So what you want to start out is getting a foam roller. It doesn't have to have these pokey things. It can be any foam roller except for the pipe ones in the weight room. I don't like those. But any foam roller that you can get, start with your back because all lower extremity injuries derive from misalignment in your back. So you want to start with your roller and start in your thoracic back, which is the middle of your back. So you want to align your feet straight, get on the roller, put your hands behind your head, and simply roll up and down your back, and then pause on the middle back. Make sure that your hips are raised up and that your back is not sagging. And you might hear your back crack a little bit, but that's okay. That's your vertebrae realigning. So just roll on your back, get your shoulders that are kind of tight. You can lean to one side, lean to the other side. And again, hold down in the middle. And then get your lower back, lean to the right, and lean to the left. You want to do that for about a minute. So immediately after you're done rolling out, you want to stretch it. So as soon as you're done rolling out your back, you want to do some cat dog. So get on all fours and arch your back and your neck up and arch down. And do this 10 times to loosen up your back and to realign it. Now, some important muscles that a lot of runners forget is your pecs. Sitting in class all day, you kind of hunch over, so these become stronger than your back. You don't want that because you don't want to be running like this. You want to be running like this where your lungs can get the most oxygen, right? So you want to roll that out too. So get a tennis ball or a lacrosse ball, and this kind of hurts, so just be warned. Put the ball on your pec and just roll it out. It kind of hurts. Just sway back and forth on it. Don't go too hard, but stop on the knots and just let it open up a little bit. Hold that for about 30 seconds. And it doesn't feel good, like I said, but you'll see the benefits later. And do the other side. Roll it around like that. Again for 30 seconds. And then immediately after this, like I said, you want to stretch. So you get the most benefit out of it. So what you do then to stretch this muscle is you lay on your side, bring your legs up, bring your hands together, and open up your back. It should stretch your back and your pecs. So I'll hold this for about 30 seconds. And then switch. And then hold. See, the side on mine is a lot tighter because my hand isn't touching the ground. Don't force your hand to touch the ground, just go to where your body lets you. You'll eventually loosen up to where you can touch the ground, but as you can see, someone who does this every day still gets really tight there, so it's important to loosen up. So again, hold that for 30 seconds. And then the next important muscle group is your glutes and your hips. So get your tennis ball or your lacrosse ball again, and get on what we call your glute med, which is this top muscle of your butt right there. So sit on that and just roll it around for about 30 seconds. And when you feel a knot, just sit there. This is called active release therapy, and you can see my leg kind of jumping. It's because the muscle's knotted up, and with that pressure from the ball, it's pinpointing that pressure until the muscle is spasming to release itself. So you'll probably feel that too. And after about 30 seconds of finding those knots and holding on them, then you want to lift your leg up and just move it. You might hear a little crack, and that's okay. It's just your muscle releasing itself and your hip joints aligning. And you can move down to your piriformis, lift up. So just really loosen that up. And then on the other side, same thing. Get your glute med, find those knots, hold. Let your muscle relax on it. And if you don't have a tennis ball or a cross ball, that's okay. You can use a foam roller, but it's not as effective in this muscle group. I would highly suggest going to Walmart and buying a tennis ball. They're not that expensive. Move your leg up and down. Release. And again, like I said, it's really important to stretch after you do that release. So cross over, do some ankle turns just to loosen up, 10 one way, 10 the other. Hold this stretch. Roll your ankle on the other side. You might hear some cracking, again, that's okay. Next is your hamstrings. So get your roller again and get up on it on one leg and lean your quad or your hamstring to the left so you're getting the left side of your hamstring. Go all the way up and down. Then move your leg to the middle, get the middle part of your hamstring for about 10 rolls, and then lean to the right and get the right inner portion of your hamstring. It's really important that you don't just roll the middle, because everyone pays attention to that. What are most important are all three, but especially this inner one, because we forget about this muscle, and it's often one of the weakest muscles in a runner, surprisingly, so make sure you get that. And again, stretch. If you guys have a TheraBand or a stretching rope, that would be best. It increases flexibility. I got this rope from Home Depot and I just cut it and I burnt the edges so it doesn't fray. It was like $5. So you want to put the rope at the arch of your foot. Bring your opposite knee up, because you want to decrease that arch in your back. Flex your foot, and you want to just easily pull towards you and down. This is called active stretching. You don't really want to hold it for that long. And down. So I usually do 5 of these. Straight up. And then I point my toe to the right to get this, again, this inner portion stretched. So notice how I'm not jerking my leg around. It's a very slow, deliberate movement. You don't want to jerk because you can pull a muscle that way. And stretching isn't about how far you can go or anything like that. It's just about stretching that muscle and waking it back up. So now point your foot the opposite way to get this outer hamstring. So point your foot out and do 5 pulls that way. And if you do this every day, you'll be amazed about how flexible you can be. Pull it to your chest a little bit to realign this hip. And the other side. So, get your foam roller. Again, point your toe in and lean a little bit to get this inner portion of the hamstring. If you find knots in your hamstring, again, just sit on them for a little bit. Let it release. If you don't have any, just roll. Get the middle for 5. And then point your foot out to get the outer. Now, I know this seems like a lot of work beforehand, but putting in the work to get your body and your muscles activating the way they're supposed to before you run will save you a lot of time from cross training, and save you a lot of time from going to the trainer to reduce injury. So then get your rope, leg up, arch your foot, pull towards you gently for 5. So I'm getting the middle first. And then point in to get the outer portion of your hamstrings. And then point your foot out. Okay, pull your foot in, or your leg in towards you. Switch off. This is realigning your SI joint, which is in your hips. And slowly just rotate in and out. You might hear some clicking on this. That's just because your hips realign and you're fine. Okay? Now, your quads, get your roller, and you want to get what is called your hip flexor, this portion right here. Focus on the inner and outer. So first I would recommend rolling up and down all the way and holding on your hip flexor because that's the most tight on this. So kind of just sit there and then roll up and down for 5. Then tilt your body to get your IT band. And then tilt it the other way to get your inner quad. Just roll on that. Then switch legs to the other side. So get your hip flexor, hold it there for a little bit. Then get your IT band. And get your inner leg. Okay, and again you want to stretch those muscles. So everyone knows standing up and stretching your quad and the butterfly of stretching your groin. So hold those for about 30 seconds. Just loosening yourself up. And last, your calves. So get on your calf muscles. And again, you want to get the side, the middle, and the inner. So start with the outside, roll your foot out, and just get the outer portion of your calf. A lot of our calves are tight, so again, if you feel a knot, just sit there and let it release. Get the middle portion. Make sure you go all the way up to where the insertion point is, which is right there. And then roll your calf in to get the inner portion of your calf. Do this about 10 or 20 times depending on how tight you are. So again, on this leg, pointing my foot in to get the inner portion of my calf. Stopping if I feel any knots. And then getting the middle. And then the outside. And then if you want to get your stretching rope or your TheraBand, you want to put it around your foot, and you want to put it around the ball of your foot and then just pull gently, not hard. So like a gas pedal, because it teaches your calf muscle to activate correctly, especially after it loosened up all those knots. And then you can hold it for a little bit, put your head down so you can feel that stretch, hold it for 10 seconds, And switch. Pull your foot in. This one's tight on me. Push out. And hold, head down. And then you should be ready to go. Do some high knees and butt kicks to warm it up a little bit more. And if you do this as much as you can, at least once a day or once every other day, whatever works best for you, that would help a lot. So let me know if you have any questions. Thanks.